Hi you guys, welcome back. My name is Dr. Abby and I am a chiropractor at CHIRO for Moms, CHIRO for Kids, and CHIRO for Chiros. And we are a clinic in the Twin Cities area and we specialize in prenatal, postnatal, and pediatric chiropractic care. So that is what our YouTube channel is dedicated to education, but specifically this niche down playlist, right? These videos are going to be really geared towards the providers out there, no matter what sort of field you're in. Hopefully you're finding something that really resonates with you, that helps you kind of hone into the clinic of your dreams if you've been wanting to specialize, whether that's with kids, pregnant women, geriatrics, you name it, there is something out there for you. So let's dive in. Today is all about pediatric care, and when I see pediatric care, I need to specify, because one of the biggest questions we get asked is, when do you stop treating boys, right? We specialize in women's chiropractic care, but we will see boys and girls up to age 8, and at the point that they turn 8, the girls will then go on the women's side and be treated under our girls treatment, and then we refer the boys out for chiropractic care, just because at that point, quite frankly, most of the boys are too tall to be on the table. They've hit that growth spurt. And then on the second half, right, bodies begin changing and there's hormonal shifts and they start to really tune into their bodies, that we want to make sure that we support them best. So that is where we've created that divide. We have to do it at some age, right? And so we do it at that 8 mark, and we refer them out for amazing chiropractic care. So I'm going to dive into our big 3, and I couldn't quite narrow down it to just 3, so there might be a little subsets in between, so bear with me. But number 1 is incorporating soft tissue work. Sometimes I think we tend to forget that they have soft tissues, they have muscles, and those muscles do get tight, and their fascia is tight, just like you and I. You're right, their stressors look a little bit different than ours. They probably aren't having meeting stress and work stress and relationship stress and school stress, but they went through the birth process too, and they also feed off of the energy in the room. So they hold on to things, and if there's tension in the body that they don't know how to release, they often cry, they get upset. So put the adjusting aspect aside and remember that your job is also to calm the nervous system, right, from head to toe. And so incorporating other modalities for soft tissue work can be incredible, one of those being craniosacral therapy. And doing craniosacral therapy because you've learned it from someone who is an expert in craniosacral therapy. And there is different seminars and trainings out there, but yes, anyone can do the basics. You can Google and figure it out, but there are other aspects to craniosacral therapy that you cannot learn from a piece of paper. You have to learn it from an expert, and that expert did exactly what we're doing here. They said, this is what I want to be amazing at, and they honed in and they dedicated everything they had into being the expert in what they do and then serving that to others. And so I think as a healthcare provider, I'm going to honor that they are the experts, and I'm going to take that, make it into my own treatment, into how I care for patients, and then use that, create my own, and become that expert in pediatric care through incorporating different topics, different things, to not just care for the joints, because those joints need support. That nervous system needs support head to toe. Remember that there is a fascia from your tongue to your toe, and if at any point it's taut, the whole line gets taut, just like a piece of rope. So with the craniosacral therapy, reminding parents that it looks like I'm doing nothing, but I'm doing so much work in balancing that brain flow, balancing the fluid within the brain, so that communication is working in an even manner, because everything up here is going to affect everything down low. It's going to balance out those nervous system communications going out to all the limbs to help your babe grow and develop, especially in the first 12 months. They're going through so many different milestones that the more relaxed we can have that babe, the easier it's going to be for them to grow into their own body. And then incorporating soft tissue work, just as you would you and I working on any other patient. They have muscle tension, so doing a nice glute massage, working through the piriformis, especially if they're dealing with constipation, huge one, gas, Remembering that those hip flexors might be really tight too. They're in that scrunched baby position. They're being held all the time. Those muscles shorten. So finding those stretches to lengthen out the hip flexors to help release tension within their bodies to help them create a more balanced nervous system. The second one is energy in the room. The way that you create your space to be pediatric friendly, pediatric safe. And that begins with communication. So when parents come in and we all get settled, I always ask first, have you yourself been to a chiropractor? And you'll get the whole gamut of things. You'll get one yes and no, or you'll get a combo thereof, or, a story of how it was years ago and it was her best friend and it was a one-off thing and whatnot. And you just roll with it. But reminding parents that there won't be any sounds coming from kiddo, especially under 12 months. It's gonna look like I'm not doing anything, just like in the cranial work. Because of the sustained pressure and the vibration, the vibratory sense of the adjustment, it's not gonna look like much, but they're cartilaginous. There aren't any sounds that are really gonna be coming beneath them. I'm not going through a full HVLA adjustment because it's not necessary. And so assuring parents that it's not gonna look like what you're seeing on TikTok or on Instagram or on Facebook or on TV. Those sounds will not come from your kiddo. And you usually will get the sound of, oh, okay. Like, okay. Settle in, remind them that it looks different even if they've been adjusted. And that this is their appointment too. So even though I'm the one working on your kiddo, you can interact with your kid, play with your kiddo. I can do treatment with you holding kiddo. Make it so it feels like you are now giving me baby. I will now take care of baby. It becomes this interaction. It's playful. It's fun. It should be a welcoming experience, not something where it feels like they don't necessarily have the control of the appointment either. When it comes to our older kids, a lot of times involving toys. So kids, 50-50 on whether they actually like the sound of a chiropractic adjustment, right? Calling it popcorn, calling it the pretzel, making it a little bit more fun. But also having ways where you can encourage kiddos to go into a spot, right? So we have rainbows painted on one wall. We have the clouds painted on the sky, and we count the clouds and we see are there sheeps in the clouds. We make it a game. For the anteriors, right? Have them hug a baby. And then you give them a hug, but always asking, can I give you a hug now, right? Make it fun, make it light, make it playful. And then incorporating that soft tissue in between. Once the kiddos get older, especially around that 15 months plus, they don't sit for cranial work until they're older. So we don't require cranial work at that point because quite frankly, they're just not going to sit for it. But we will do stretches, right? So, how big are you? How big, right? We're really stretching through the shoulder girdle, or we give a nice hug. Okay, and we're going to give another hug because we want to open up the shoulder girdle this way. That word's becoming very difficult to say. Or a down dog or cat cow, and you make the sounds. Allow yourself to be a little bit silly with them, and it becomes a good experience. They want to come back. They want to be there. But then also making sure that you have the stuff on hands to also look in the mouth and look in the ears. Kiddos come in with earaches all the time. You know how many times parents have said, can you just look in their ears real quick? Are they red? Do I need to take them into the pediatrician? We do look in the ears, right? Make it a one-stop shop for mom and dad. We will look in the tongue and say, there is some restriction. Let's refer out. Let's get a second opinion from pediatric dentist, from an SLP, from a lactation consultant, someone else to look inside the mouth. But in the meantime, I'm going to give you the stretches. We're just going to hit the ground running at this point, knowing that there is some tension, but what the next steps is beyond stretches, that's up to our second opinion on what needs to be done. So we have number one, incorporate soft tissue. And then number two is the aesthetics that you create. What sort of energy are you going to create within your four walls to make it feel pediatric safe and comfortable? And pro tip, having a nursing room possible or a feeding room is game changing. And last but certainly not least is you have every right to specialize your specialty. And where I'm going with that ties into what I talked about in the beginning. Yes, we specialize in pediatric care, but we specialize within that pediatric care in infants. We market 0 to 12 months of age because that is where the most milestones are going and being met. That's where the most growth and development happens. That's where you also have time. That's where parents have the most time that they can set aside appointments. Once kids hit that school age, they've got sports, they've got friends, they've got family events. All of a sudden, you get lost, and kids are resilient. Their bodies bounce back real quickly, right? Couple stretches, adjustments, get them feeling good. Their bodies are so resilient. And in that 12 months, their bodies are even more resilient that we can get so much work done in a short period of time to support them in the long term. Specialize your specialty. Be okay saying, I treat kiddos, but I specialize in 0 to 12 months. There's nothing wrong with that. You become really good at that 0 to 12 months. You know those milestones. You know the importance of vestibular inputs with the development. It's not something that's on parents' radar, but it's on yours. And you're there to support and to help them all the way through. So when they hit that 12 months, and they're up moving and crawling and walking and doing all the things that they need to be doing, their body's ready to support them. And so then all of a sudden they just become maintenance because they're resilient and they bounce back. And you just have to release that tension just like you and I do now. And we bounce back. And then when we need more support, we come back in. Those are your top 3 pediatric tips for niching down, for specializing. If you have more questions, please, please, please do reach out. Happy to answer them. And who knows? Stay tuned. There might be a part 2. So make sure you subscribe. You let us know. And get treating those kiddos.